Welcome, Dr. Jaime Seeman. We're so thrilled to have you here. I've been following you for a while and your journey. You have like all of these different incredible hats that you wear and these amazing buckets where I'm like, wait, she did that too?
I know you're like a woman of many talents.
So thank you for joining us today. I want to start with how in the heck did you after it seems like you had a collegiate like you had a what did you do in college? What was your
Yeah,
sport of choice?
I played college softball. I grew up as an athlete. I really wanted to compete at a high level and had the opportunity to play D1 college softball. And then I wanted to be a doctor. So my life made this like big 180 transition from, being the physical athlete to now going to medical school and kind of throwing my softball glove in the closet and being back in the classroom and library for long hours.
What made you decide to be a doctor? Was there something that happened that changed the course of your life?
There's no doctors in my family. My mother was a nurse growing up, and I'm very much like my mother, with, nurturing, loved kids. And my mom always thought I was going to be a teacher, but I'd always said I'd love to be a nurse too. And then as I kind of got into high school and started to get into being involved in activities and leadership and these types of things, my mom said, if I had to do it all over again, I would have just gone to medical school. And that really resonated with me. I think sometimes, as a little girl, what we see in the world of like what we could do or what we're capable of, you kind of look around in your life. And so I really admired my mother and I saw how hard she worked, and she transitioned from bedside nursing into administration for most of her career. And so she was kind of like the boss of the surgeons. She was an administrator for the Department of Surgery. But it was really like that moment when my mom said that I was like, oh, like I could be a doctor. So then I kind of shifted this and I grew up in the era of like ER and George Clooney and, what I'm seeing on TV was like these really cool, characters, and it looked fun and it looked exciting. So I thought I was going to be an emergency room doctor. That's what when you start medical school, they actually have you kind of guess what you're going to do because you don't know what kind of doctor you're going to be. You're just going to have a medical degree. And so I wrote on my prediction card that I was going to be an ER doctor. And then that very much shifted in my medical training. My mom said, I don't care what you do, just don't be an OBGYN.
Oh my gosh.
And I went through my training and we got into the clinical aspect where you're on your what they call rotations, and you do psychiatry and family medicine and peds and surgery. And I got on the surgery rotation and I just loved it. I was watching liver transplants and I was watching ortho and general surgery and all of these things. And I had my OBGYN rotation really late in that year. And I got on the rotation and I was like, wow, this is cool, because for the first time in my life, I'm participating in like a happy kind of area of medicine. Like who doesn't love delivering life? Like this is the coolest thing ever. And sometimes it can be really scary, but I didn't realize how much surgery they did. So gynecologists do hysterectomies and pelvic floor surgery and all these different types of surgery. And so it was just this perfect blend of like just taking care of women, doing procedures, delivering babies. And I thought, I think my mom is wrong. I think this is where my passion lies. And I remember going home and I was like, Mom, I think I'm going to be an OBGYN. And she goes, you're dead to me. She said, I'm menopausal. I'm menopausal and I've had a hysterectomy. She's like, why don't you do plastic surgery or something? So for a while, I actually thought, well, plastic surgery would be cool. But I was in the midst of getting married and starting a family and having my first daughter in medical school. And so with the most supportive partner ever, I pursued being an OBGYN, and I have never looked back. I absolutely love my job, or my hobby, as some of my trolls on the internet call it. And I'm so happy. I love taking care of women. And then as fate would have it, God gave me 3 daughters, and here I am.
Okay, so are you practicing full-time still, or do you have all these other things that you're doing?
I am a full-time OBGYN. That is my job. I'm not an Instagram doctor. I work in the clinic Monday through Thursday. I'm off on Fridays, which gives me the capability of being on podcasts and doing my social media and maybe laundry. And And I just love it. There's, of course, I don't call it a balance. I call it a harmony. There's life, there's kids, there's work, there's all of these things. But what I've really discovered through the whole process, and I had this epiphany in 2015, we can talk about it, but I realized that taking care of myself, I call it pay yourself first, by eating well and training and creating mental and stress resiliency, all of these things have allowed me to wear this many hats. The way that I live my schedule in my life is definitely not for everybody. But I like being productive. I like being busy. I know when to unplug and when to relax and when to hit the gas pedal and when to hit the brakes. And that is definitely something that I've just learned through 40 years of life. But I love what I do, and I am a full-time doctor.
Holy cow. So you have a TED Talk, you have a podcast, you're on podcasts,
You're a mom.
Super fit. You're a mom. You're doing all of this.
Yeah.
And then you throw in there, The Rock invited me on the Titan Games.
Yeah.
How in the heck? Okay, first of all, how did that happen? And then how did you get in shape? Because you kind of mentioned if I read this correctly, that you kind of, weren't in collegiate shape when you were going through and getting this done, which I don't think any medical physician going through, medical school is at the top of their game, because
it's so demanding. Yeah. Just the time. Yeah. So when I was a collegiate athlete, I'm in the weight room, I'm lifting weights. But I always, I think as a young girl, being physically strong, wasn't when I'm reading my Cosmopolitan magazine, these women are very thin and they're in bikinis and they're not showing off their quads and biceps and things like that. So I always kind of had this thing in the back of my mind that I can't wait to go to medical school and just get rid of these muscles. And I think I have, this trophy behind me. I'll move for just a second. For the people watching on video, that's a lifter of the year trophy. I was a 2-time lifter of the year at Nebraska. But when I went to medical school, there's this big shift. I'm suddenly very sedentary. And I had a degree in nutrition and exercise science. So if anybody should have known how to take care of themselves, it was me. But I had a shift in my schedule. I was more sedentary. I stopped weightlifting. I was just doing cardio. And my body changed in a way that I actually wasn't positive. I realized that not lifting the weights, it's actually not the body I was trying to achieve, but I was busy and I was being a mom and I was just doing the best I could. My husband was a police officer and he's working nights and weekends. And just like every mom listening, right? We're just trying to do the best we can with the knowledge that we have. So fast forward, I'm finishing medical school. I'm in residency now. And I'm not in the best shape of my life. I'm trying to give myself grace because I have little kids. But I wasn't feeling good. I was tired. I had hypothyroidism. I was on medicines for that. When I was trying to get pregnant with my daughter, they told me I had PCOS. I had to go on metformin. They talked about giving me Clomid to ovulate. And then here I am, I'm practicing as a doctor. I'm taking care of these women who are complaining of the same things and the same struggles that I was. And although I can tell them everything to do, how do you, and this is the $1 million question, how do you take all of this information and translate it into real world action and results? And so in 2015, I had a really bad tragedy that happened in my life. One of my best friends passed away in the middle of her pregnancy. We were both pregnant at the same time. I was pregnant with my youngest daughter, Kimber. And I had just this awakening of a sense of my own mortality. I could be dead tomorrow and my husband would be left with these children. And I don't know how much time I have on earth, but this isn't how I want to go out.
Yeah.
And so I went back to training. I actually went back and completed an integrative medicine fellowship, which is just another way of looking at a person and looking at their health. And it's much more preventative based. It's much more lifestyle based. It looks at, what alternatives we have, besides just writing prescriptions and doing surgeries and things like that. And I found that patients were starting to ask for that type of thing. And so I thought, if I'm going to ask my patients to do these things, I have to be the breathing, walking, talking version of that. And that's where Dr. Fit and Fabulous was born at 8 p.m. on my couch one night. It was a shift in mental language for me. I call it a declaration without evidence. This is who I am. I know it doesn't look like that. And I know it's a continuum and it's a journey and you have to work to stay there. But I started to get back in the gym. I started waking up at 5 a.m. I started working out. I started watching what I was eating. And over 2015, 2016, 2017, I was slowly making progress and I was sharing it on social media just as a doctors are patients too. I got all the same things you have to do and I'm trying to figure out how to do it. And then in 2018, 2019 is when I started lifting weights again. So I actually started with nutrition, then finally started lifting weights again in 2018. And in 2019, I'm scrubbing into a C-section, putting my gown on, putting my gloves on. And this scrub tech was like, hey, have you ever seen this show called The Titan Games? And I don't watch TV. I have like 3 little kids and I work as an OBGYN, so I can never watch TV. So I went home and Googled it. And I was like, wow, this looks like American Gladiators from my childhood. And I remember watching it as a little girl, just thinking like Diamond was like my favorite character and like just how badass she looked. And I was like, wow, like this is really cool. But like, I don't think I can, I'm like about to turn 40. Like, I don't think I can do what these women are doing. But it just kept bouncing around in my head for many months until I finally got on their website and looked at the application and what would be required to like apply and try out. And fast forward many months, I got a phone call. The Rock wanted me to be on Titan Games.
Incredible.
And it was just a whirlwind. It was just a whirlwind. And I'm so glad that I had the opportunity. It was so fun to like put on the uniform again and compete. And I think athletes never lose that, competitive spirit. So it was such a fun thing. And I'm just so grateful that my 3 daughters were in the front row witnessing it.
So how old were they when they're seeing mom up there?
We filmed in February 2020. So that's 5 years ago. Let's see if I can do math. My girls were 9, 7, and 5 when I filmed Titan Games.
That's so fun.
What a cool experience.
And there was one other mom on the show. They pitted us against each other, these 2 moms. They have a storyline. Yeah. It's TV.
Yeah.
And it was so cool. And a lot of people ask questions about the show. So when you go to YouTube and watch it, you can go to episode 1 or 3. Those are the 2 that I'm mostly on. And you actually don't know what you're going to do. They like walk you out into this filming studio and they're like, okay, we have this chain link fence suspended from the ceiling and you're going to scale the fence and jump over here and pull on these chains and like do this. And the first person to pull the handle wins. And you don't get to touch it. You don't touch it. You don't practice it. And this isn't like stuff you have in your gym anyway, right? Like nobody has ever done this before. So it was wild and crazy. And
was it really scary ever? Really Were you nervous?
Oh yeah. I mean, of course, like the competitive athlete side of it, you're like, God, I hope I don't embarrass myself on national television. And the tryouts, actually, this would be a great story for most people. When I went to there was actually like a tryout, like a physical tryout that I had to go to, and you had to do like a max VO2 max on a treadmill. You had to do a max deadlift. I hadn't deadlifted like since college, and I peed my pants deadlifting. I literally peed on the floor. And I'm like embarrassed, right? They're like, can we get a towel over here? And the guy looks at me and he's like, you're the 3rd person to do that today. And I was like, oh my God.
Oh, yeah.
I was like, this is so mortifying. I'm like, they're never going to ask me to be on the show if you're going to like pee on the floor. And the producer was like, did you go to the bathroom before? I'm like, yeah. Have you had 3 9-pound babies out of your vagina? Like, I mean, yeah, it was such a fun opportunity. And I'm so glad that I had it. And people are like, are you going to go back and do it? And I'm like, they haven't brought back Titan Games, but I've heard rumors they actually are bringing back the true American Gladiators here soon. So it's cool to watch those men and women compete. And of course, everybody shows up with this like crazy story, right? Like they had their left leg cut off or their mom passed away last year. Everybody has this inspirational story. So you're just standing among these people like, how did I get here? Like these are the most awesome humans. And I've stayed connected with a lot of people from the show, and most of them really are great people too.
That's amazing. How in the heck? Okay. So then when did you write your book, which I see behind you, Hard to Kill? I want to know the title. It's a powerful title. And what year did you write that? What do you hope readers take away from it?
Well, kind of around this, time, I'm doing Titan Games and I've had all these cool opportunities. I had always toyed with some of my close circle about, gosh, I should write a book. And then you go back and forth as a writer, like, what do I write about? Like, do I write about pregnancy? Do I write about this? Do I write about that? What do people want? And for me, my social media has just been like the true authenticity of just life. And so I thought, you know what, I'm going to write a book about my journey and how I got here and how I did it so that somebody else can read this and maybe be inspired and try to replicate this in their own life. And so One day I'm like driving my car up to our business, and I was like, hard to kill. I don't know. It just like came to me, and I was like, that's the language. That's the language in my mind of like, it doesn't matter what you've overcome. Like your friend died and you have 3 kids and you have all this stuff, but like, I'm going to be hard to kill. And it also is kind of like a metaphor of like in medicine. I mean, here's the thing is I have friends that are like the most successful people and millionaires and billionaires and all these people. And I think if you ask the most successful people in the world at some point in their life, like something fails, they get divorced. They like, you just never know on a Tuesday when you're going to get a car accident or you're going to get COVID or you're going to like, life is just going to happen.
Yeah.
And to lead, like to wake up every day and love your life and just lead the most amazing life. Like you just have to have this mentality of like hard to kill. Like nothing is going to stop me from continuing to pursue just amazing things in life. And so it's built around 5 pillars. The first part of the book is just my story, and it's built around these 5 pillars. And the pillars are nutrition, exercise, sleep, kind of mental and physical resiliency. So I talk about like ice baths and saunas and things that I've tried and did. And then the last one is what I call environment. And this is like the people, places, and things that are in your life that do have an impact on your health and wellness. And so it's just built around these 5 pillars, and, you know, people can pick which one they want to start on. That's what I did. And it's a continuous process of, you know, along the way, my nutrition even has, you know, molded and changed, and you just figure out what works for you and what makes you feel and function better. Because if you go to the internet, I'm telling you right now, you're going to be confused in about 3.2 seconds. Like
you don't
one person's going to tell you to eat plants, and the next one's going to say, no, eat meat only. And then one's going to say ice baths are good, and the next one's going to say they're bad. And it can be really, really, really confusing. And so people just have to figure out a place to start and just go.
All right, then if we start there, because I'm thinking as you rattled those off, okay, well, the you know, your story, we've heard that you have, and this, I always feel like sleep gets kind of poo-pooed because it's kind of like, yeah, we all know we have to sleep. Have you met menopause? Have you met perimenopause? Like, it sucks. But that one, people at least, I don't think it gets enough love. People know it's important, but we have sleep. But then when you mentioned people, place, and things, and I've had to, I feel like over the last couple of years, my circle, I don't know about you, Laura, but my circle has gotten a little bit smaller because I've realized maybe it's really hard for me to let go. I give people a lot of chances, and it's really hard for me to let go of maybe people that aren't fitting your narrative anymore.
Yeah.
And that doesn't mean disagreeing with your narrative, but like just not fitting into your life. And maybe that was a season friend. Is that what you like? Do you talk about that? What was, I'm curious about how you thought about that chapter.
Yeah. So you kind of touched on it. You know, they say people come into your life for a reason, season, or a lifetime. And it's these lifetime people, your close inner circle, your tribe, your squad, whatever you want to call it. It's the 3, 5, 10 people that you spend the absolute most time with in your life. And these people absolutely and utterly impact your health in a profound way. We start to do things that the people around us do. And as a child, when we're learning, we don't really lose that. As adults, it's called mirror neurons. So it's like how we learn everything in life. We just watch what other people do. And so if you are wanting to be healthy and you look at your inner friend circle and they're not healthy, like it's not going to feel good to suddenly start changing all of your behaviors because you're not doing what they're all doing. And then people will start to question you and people will start to judge you and people will say, well, I liked the old version of you. And it is a really, really, really difficult thing to break. But one of my mentors gave me a prime example. He's like, if you want to own a yacht, like go down to the yacht club and just hang out with those people and see what they do. And the more you hang out with those types of people that you aspire to be, you will naturally start doing the things that they do, and you will naturally start seeing a lot of the results that they see. It's why people find mastermind groups. It's why people need really good mentors. And you absolutely have to choose those people that you hang out with very, very wisely. Very wisely.
You had to let go of toxic people that
100%. Yeah. I mean, I've learned how to create boundaries. I've learned how to, just keep people, it's relationships are 2 ways. There are people that, your mom, right? You can't just cut her out of your life, right? Like
Yeah.
she's still your mom, but if that relationship is an energy drain and not an energy add, then you have to figure out how to create boundaries in that relationship. And you know, this is one of the most difficult things for most people. But I have watched you said your circle got smaller, over my journey since 2015. I mean, my inner circle has really morphed and really changed. And at the end of the day, you have to do what's best for you and what you're pursuing.
Yes, I feel that 1,000,000%, especially in a position like you where you have, as we said at the first, you have a TED Talk, you have a book, you're very successful, and you find out who your tribe is of those people that really stick with you through this journey of life and different seasons of life.
Well, and you have to understand too that as you kind of, I'm not gonna call it a totem pole, but this like proverbial totem pole of like, kind of like moving up in life and moving up energy levels. Like people will shoot arrows at you, and it's I found that on social media. Like the comment section is not always kind.
Yeah.
Even when your intentions are really good. And so, you have to kind of create these boundaries and this armor. And it's not an easy thing to do, but you just practice it. You just practice it every day. But our actions are driven by our internal language. So the starting point for all of this is changing that internal language of like who you are, your computer processing system. And if the people around you, if that's not what you aspire to be, then you have to start to create the distance and the boundaries.
Was it hard for you to create boundaries? Have you always been good at it, or is it something that?
No, I'm like I don't like conflict. I don't like saying no.
Haley and I are the same way.
Like, I like to please people. I want everyone to love me. Like, it is really difficult. It's not an easy thing. And a lot of it is, like your personality and your traits and things like that. And I've done so many different personality tests and, like all these different things, but, yeah, it's not an easy thing. It's not an easy thing. And sometimes, we cut people out and then we like bring them back in. It's like, like a bad boyfriend, you just keep letting these people come back in and then you expect different results. Like that's just, you cannot expect the people around you to change. So you just have to go to the places and plant your tree where you're going to flourish, where you're going to grow.
Energy drainers. Is that what you called it?
Oh yeah. I mean, I'm sure everybody listening right now can like name 5 people where it's like when you spend time with them, like you come home more depleted. Like you need to be around people that like energize you and fill you up, and you got to get rid of the energy drainers because they're everywhere. And there's actually really interesting, like in the workplace, for instance, if let's say you're in like a job that involves cubicles or whatever, like even if you're just seated within a certain distance, like let's call it 15 feet of like a low performer, like you will perform at a certain percentage lower. And if you sit around somebody that's a high performer, you will perform at a higher percentage. That's literally how real this type of relationship is you have got to surround yourself with high performers. You have to get in rooms where people are smarter and better than you at everything that you're, going after. Like that's how you grow yourself. Like my kids play softball. Like I don't want them to be the best person on the team. I want them to be on teams where people are better than them because we tend to rise to the level of the people around us.
Mm-hmm. That's so true. So if we move on to your strength and nutrition, what has changed for you? You think you said you were 40 in 2020 or around 40 going into the Titan Games. Do you feel like your nutrition from your 30s to now, what you're speaking about and what your non-negotiables are at this phase of life, what's changed?
Well, I did not grow up on the best diet. God bless my parents. They were just doing the best they can. But I grew up like
helper? That was me.
Hamburger helper without the hamburger. Otherwise known as pasta. Rice and pasta. I grew up on a lot of carbs. But when you're young and you're an athlete, like you can get away with, I take care of professional athletes. I'm the team doctor for the Omaha Supernovas, our professional volleyball team. Some of our young players, I'm like astounded at the food that they eat. Like these are the highest level performing people. And you're like, you eat like shit. Like if you ate well, like I can't even imagine how you would perform. So, I mean, I got away with a really bad diet for a long time. And then I get this degree in nutrition, and it was like really beat into me of just like caloric compliance, like count your calories. Fat is not good. Like, don't eat a lot of fat. And so when I got into medical school and I was struggling with my weight, I went back to like food tracking, and I'm telling you, I was counting goldfish crackers. Like, okay, well, I can have 50. And I was just counting calories. And then I found out, right. They tasted good. But I found out I had prediabetes. My A1C was elevated. I had hypothyroidism. And so when I first started on my journey, I went really low carb. I was ketogenic for quite a long time, and I felt amazing. And my mom and my dad are both like normal BMI diabetics. And I've done like a lot of genetic testing. I have like every susceptibility gene to diabetes. Like, it's just like, it's in my DNA. And so I still to this day eat very low carb, but I started to like play around with like, okay, how much protein and like how much fat. And because we all respond differently, we respond differently based on our DNA, we respond differently based on our activity patterns and our schedules, like what time we wake up and what time we go to bed. And so there's like not a cookie cutter strategy. I think for anybody listening, the more you can eat single ingredient foods, like, did it have a mom or did it grow in the ground? Like, you're probably going to be doing pretty darn good if you can just eat single ingredient foods, because most of our food environment is like boxes and bags and jars. And the more you process something, like, I'll drop a bomb that most people won't want to hear, but like protein powders, like, is actually a processed food. So the more you can eat chicken breast and eat steak and eat real food, you're going to be doing better. And so there's been some evolutions of my diet, but I really try to stick to whole foods. I don't eat a lot of carbohydrates because in nature, like, there's not a pasta tree. um, so I eat berries, I might eat some squash or sweet potatoes and things like that. I really have evolved to not even really caring about like sweets. But I think nutrition is something we obviously do every day, unless you're fasting, which you shouldn't overfast. That's another thing for women. But we eat every day. And so it's an easy way to make a quick impact in your life. I mean, we start to see microbiome shifts within like 7 days of dietary changes. It can change your health really fast by just focusing on what you're putting in your mouth.
But for the gut microbiome, do you have like a certain list? Because we hear out there, you need to eat 30 different fruits and vegetables a week. This stresses me out. And I look at what my son's eating and I'm like, you're screwed. You're
Yeah. I think dietary variation is good seasonally. Like, when you think of like our ancestors, right? Like, when they lived outside, like, there was only certain things they saw. Like, they only got berries and melons in the summer, and in the winter they kind of shifted that to more like roots and tuberous vegetables. Like, I think variation is good. Mm-hmm. Do I think that eating 30 different fruits and vegetables a week is going to attain some certain level of health that's like magical? Absolutely not. Like, I just don't. As we age, our microbiome does start to shift. We start to naturally lose particular bacteria in the colon. And we actually start to see a more inflammatory type dysbiosis that just literally happens with age, because we lose our stomach acid. And there's just things that are inevitable about the aging process. But from a microbiome standpoint, I think there's some people that respond really well to fiber. There are some people that don't respond well to a lot of fiber. And so you kind of have to find, I think there's things where you just have to find kind of where that happy set point is. Particularly, one of the benefits of fiber is that in the breakdown and fermentation process of fibers in the gut, you make something called short chain fatty acids. So like butyrate. And that is where you get a lot of benefit to the colon cells and the heart and the cardiovascular system. When you're on a ketogenic diet, you actually make more levels of beta hydroxybutyrate. So there's a lot of things physiologically with the diet that you can manipulate. I think probiotics as of right now might be a little overplayed. I think feeding your gut microbiome with real foods, fermented foods, kind of playing with fibers and fruits and vegetables and things like that is probably the best way. And I think in the future, we're going to see a lot more fecal transplants happening. The data on that is actually very interesting. They can take the poop from like a obese, well, it started with mice, of course, but we're starting to see it in humans. But you can literally take the microbiome of like a thin, lean individual or animal and transplant the poop into the gut of an obese person, and they start to naturally become leaner.
Are you serious?
So I think Yeah, I think we bang our head against the wall sometimes with like, I'm counting my calories and I'm working out and I'm just like not seeing these results. Like, we have to give like more credit to our bodies. Our bodies are like incredibly resilient and they're always trying to find homeostasis. And so there has to be this like kind of like base of the pyramid, base camp level stuff that we have to nail first. And that's like going back to the 5 pillars of my book. I mean, ice baths and saunas and all these little biohacks like are really cool. But if you're not doing that like base level foundation base camp, like you can't be scaling the mountain yet. Like you got to nail this stuff first.
I literally just had a conversation with a friend about the fecal transplant this last weekend. And I was like, what?
Yeah.
I had never heard that.
We've done them in medicine for years. Like when I was in medical school, we did fecal transplants for people that had like severe gastrointestinal infections, like really resistant C. diff strains. So you put a nasogastric tube down the patient and then you literally push the fecal material, like down in there. But of course there's always risks with these things. What if you put, a bad E. coli strain down there and now you've made the patient ill? So like there has to be ways that we, choose the right poop. But one of my friends, Dr. Sean Amara, he's an ER physician that's he's big on social media with like visceral fat and the microbiome. He has like one of the best, he's a very meat-based person, which most people think, right, fiber and vegetables gives you the best microbiome, but he has one of the best microbiomes and he eats tons of like fermented foods. So I started playing with these different varieties of vinegar recently and kind of adding those into my schedule. And I think that we don't think as much about our gut bacteria as we should give it credit for, because I think it actually has one of the most profound impacts on our overall health.
That's kind of what I'm interested in seeing over the next decade of where the gut microbiome, because I feel like it's kind of gaining momentum, but it's like this whole world that we still don't know. There's still a lot to know about.
Well, and it starts in the mouth. So you think of like, people think that food is the only thing that impacts it. But like the way you breathe, like if you're a nasal breather versus a mouth breather, you have different bacteria in your mouth. And a couple of years ago, I was asked to go speak at this functional kind of health conference that was dentists and medical doctors at the same conference. And I was listening to this guy talk about the microbiome, and they do like a salivary test to test for particular bacteria in the mouth. And he's showing me the literature on these bacteria that they test for. Some of them are implicated with pregnancy loss, infertility, preeclampsia, babies that are growth restricted or too small. So they've isolated, like if you have these particular bacteria in your mouth, you can have adverse pregnancy outcomes. Like this is crazy. I never learned about this in medical school. So of course I like did the test and I had this one particular bacteria called Fusobacterium nucleatum in my saliva. And it's actually implicated with an increased risk of colon cancer. So like I started changing like the toothpaste I was using. I started doing like mouth taping at night. I started like, it's just wild to think. I mean, it starts in our mouth. I mean, we always think about gut, like it's down in our stomach, but it starts in your mouth because I'm going on all sorts of tangents right now, but
yeah, I'm loving it. For the tangent.
Wow.
Okay. So first tangent is, this is how I love to explain it to people. Think of your microbiome like a cruise ship, and the cruise ship is full of a lot of passengers. Those are called your commensal bacteria. They're just kind of along for the ride. But then of course you have like the captain of the ship and you have all the workers on the ship. And these are like the good guys that kind of like move the ship forward from port to port. Well, occasionally we can get a pirate that a Somalian pirate like takes over your boat and holds you hostage. And a lot of the tests that these people do on the saliva is to look for these pirates, because if you get a pirate, they can be really invasive and they can really mess everything up, and eventually they could sink the ship. And so it's good to know, I think, if we're talking about the microbiome, to figure out like, do you have one of these pirates? So that's kind of my analogy with that. But we have to remember that our microbiome is established when we're born. So I'm an OBGYN, and we know that vaginally born babies versus C-section babies have different microbiomes. Now, we love modern medicine, and thank God we can save a lot of babies by doing necessary cesarean sections and saving babies' lives. But we do know their microbiomes are different. And then a baby, when it's born, the stomach actually doesn't produce acid. When the baby's in utero, the stomach is actually very neutral. It's not sterile, but very neutral. And so when the baby's born, the pH of the stomach stays very neutral for a couple of days. And then when the baby starts going to the breast and it starts getting this colostrum, that bacteria is allowed to pass through the stomach and to go down into the gut and to start to populate the microbiome in the gut. And then after several days, the pH of the stomach starts to become more acidic to keep pirates out. And so a lot of our microbiome is established when we're born, how we were fed as a child. And then, of course, there's these just changes that happen as we age. But then everything along the way, how we eat, stress affects our microbiome, sunlight affects our microbiome. All of these things are like little inputs. But it is kind of like it's like the cruise captain. And so we're all on a different itinerary.
Yeah, which makes it hard which is why it's so individual. So if we move on to strength training, what does your schedule look like in a week, and what do you recommend, in your book or to your patients? Do you have any absolutes, or what does that prescription look like?
So women in particular are really sold on cardio, right? My mom she was like in the jazzercise era when I was growing up. And right, like you'll find if you go to the gym, more than 50% of the cardio equipment is generally female. But if you go to the strength area of the gym, there was a study, I think it's from 2007. They did observations in a bunch of different gyms. And if you go to the free weight section, so we're talking like dumbbells, barbells, for every woman in that section of the gym, there's 27 men. And we are starting to see a shift. The data over the last 5 years does show that more women are strength training. So thank you to people like you and all the amazing strong women on Instagram that are showing off their muscles. But if you want to move the needle with body composition, you have to be focused on gaining muscle. So instead of thinking about every woman that I see in my clinic, there's like 10 pounds. I just want to lose 10 pounds.
Yes.
10 pounds. But if you ask yourself what would be required to lose that 10 pounds, a caloric deficit, doing a bunch of cardio, if you lose 10 pounds on average, you're going to lose 3 to 5 pounds of lean tissue. And so if you shift that to thinking, I'm just going to get as strong as I can imaginably get and achieve, when you start working on strength training and getting strong, a lot of times body composition changes naturally happen. You start putting on more lean tissue, you start losing a little bit of fat. And so I think women really have to kind of change that mindset of this kind of like going from like lean and toned and skinny to like, I'm going to see how big and strong I can get. Because I can tell you right now, there is a certain genetic potential that we all have, and you're not going to look like the Incredible Hulk. I promise you. Like those people are taking steroids and peptides and all sorts of things. But if you can shift that to like, and especially as we age, I talk to my perimenopausal, menopausal women, now is the time to shift to being strong and stable. I'm going to be strong. I'm going to be stable. I'm not going to fall on a rug. I'm going to be able to hike mountains. I'm going to be able to play with my grandkids. We all obsess about the subcutaneous fat, but a lot of times going after that is going to harm us longer, in the long run. And that's one of the troubles too with these weight loss GLP-1 meds is fast weight loss is almost always lean tissue. And so fast weight loss is very dangerous. So even if we use things like medications like GLP-1s, we have to get that base foundation of nutrition and lifting weights and stimulating our muscles. And it's not just about being physically strong. Our muscles actually work as an endocrine organ. So our muscles are talking to our brain. They're helping us create new brain connections. They're talking to our endocrine organs. Muscle is the greatest disposal agent of glucose. 80% of our glucose disposal happens in our muscles. So for somebody like me that used to be a pre-diabetic, well, what happened? I stopped weightlifting for when I graduate college. So from like 07 to like 012, I was like lifting no weights, didn't pick up a weight again until 2018. So for 6 years of my life, like I wasn't touching weights and I became a pre-diabetic. And I didn't look any different. I mean, I didn't look obese, but that was the difference is I was no longer stimulating that lean tissue and I became very insulin resistant. My muscles didn't know how to soak up that glucose anymore. So if you like eating like me and you like carbs, you got to lift weights. You got to stimulate that muscle tissue. Yeah. And for perimenopausal women, you can gain muscle. I mean, don't think that like just because you're making this transition that it's like no longer achievable. You absolutely can put on lean tissue until the day that you die.
What are your thoughts on hormone therapy for someone that is not postmenopausal? Do you prescribe it in perimenopause only with symptoms? Because as you know, I mean, you're in this space every day, like we are, but the conversation is there's the menopause hormone therapy conversation.
Yeah.
And there's different sides of that. Where do you fall on that?
As a broad answer, I am a huge fan of hormone replacement therapy. As a more nuanced answer, there is a time and a place. So if you think that going on hormone replacement therapy is going to be some magical unicorn, you are a little bit misled. These foundational principles that we've talked about, the 5 pillars, you have to get those things in place before you start, adding in estrogen and things like this. Because if you pour gasoline into a system that's not working well, it doesn't make the car drive better, right? If like the transmission is broken. And so you have to understand that. And sometimes when you start correcting nutrition and you get them lifting weights again and you do all these things again and the ovaries start functioning better, sometimes you don't need it yet, right? Because perimenopause is like this roller coaster of a multi-year process, leading into menopause. And there's some evidence to believe that the ovaries actually pace our aging. Our rate of aging is actually paced by the ovaries. And so if you do things as a woman that nurtures your reproduction and your reproductive capacity and keeps the ovaries really healthy, it prolongs the number of years that you can go without having to add hormone replacement therapy. And then 100% of women at some time in their life are going to go through cellular senescence in the ovary, and they will stop producing estrogen and progesterone. And then, then you definitely want to think about replacement. But I think in perimenopause, I do use it. There's a time and a place. I like progesterone. It can really start to help with sleep disturbances. Sometimes they might need a little bit of estrogen. Sometimes they need a little bit of testosterone. But you really got to start nailing those things in perimenopause, because the hill starts to get a lot steeper once the ovaries finally, shut off, and you have to control the controllables. That's what I say.
Who are the thought leaders in this space that you really align with? I mean, is there a few people that you're like, I know there's lots.
There's so many.
Yeah.
Yeah.
I don't know if there's like a president of the society per se, because I think we're all going to have, as a clinician, our thoughts about things are all learned through taking care of real patients. And we definitely have literature that we want to be able to use to support our thoughts, because studies are very important. It's where we get objective data. And then when we take care of patients, we get subjective data and anecdotal evidence. And we use all of those things to kind of make our medical recommendations. And I think if you, looked at 20 different menopause people, on social media, like, we're all not going to agree on everything. But I do think I love the fact that the conversation is happening and that more people are talking about it. But it can create a lot of confusion, because some people are, like I said, some people say eat meat, don't eat meat, take estrogen, don't take estrogen. There are some things, though, that I think people do need to understand is that bioidentical hormone replacement therapy, there are ways to give bioidentical hormones in pharmaceutical grade options. So it doesn't have to be compounded. That doesn't make it better. There's a variety of ways to give hormones: transdermal, oral, injectable, sublingual. And that's where your clinician can really help you. What is best for you? What is safest for you? Do we monitor levels? But I love that the conversation's happening. There's like people writing books left and right,
I know
about menopause. It's like, it's finally getting its like day, and NIH is, talking about funding more studies. Cause we really, for many, many, many years, perimenopause, the reason nobody is studying perimenopause is the same reason that exercise scientists don't study women a lot in their studies. It's because when you have somebody that has a functioning ovary, your estrogen levels are literally changing hour to hour, day to day, depending on where you're at in that cycle. And then perimenopause is even more erratic. And so it's really, really, really hard to control the variables, which is why, like I said, we have to use objective data, but we always have to use that kind of subjective, how are we feeling? How are we functioning? And always weighing kind of the pros and cons of what we throw into the system.
Are you a fan of vaginal estrogen? If somebody was anti taking, hormone therapy, is a vaginal estrogen kind of in its own category a little bit?
Yeah. So low dose vaginal estrogen is safe and effective for almost everybody. I mean, really everybody. I mean, really honestly, because we even have data now showing it doesn't change breast cancer survival rates, or breast cancer recurrence, which those would be the patients, right, that we would initially like hold a 10-foot pole on and say like, none for you. But even when I talk to my breast cancer patients, I say, hey, listen, we might save you from dying from breast cancer, but you're going to die of something. And let's make sure it's not, urosepsis from a urinary tract infection, and now that we've taken away your estrogen, now you're at a way increased risk of getting osteoporosis and heart disease. Okay, so we save you from breast cancer and now you're going to die of a hip fracture. So vaginal estrogen is amazing. It's just like we put cream on our face to stop our face from aging. The vulva and the vagina, when they lose estrogen, they get thin. They lose their lubrication. We get an increased risk of urinary tract infections. It gets uncomfortable. Women don't want to have sex. That starts affecting their marriage and their relationships. And so I'm a huge fan of vaginal estrogen. And I think another population that needs more vaginal estrogen is postpartum patients. If you didn't realize it, when you are postpartum and you are breastfeeding, your vagina is like a menopausal woman. It looks very similar. The skin starts to get thin. It starts to get red. It gets very dry because when you're breastfeeding, it lowers your estrogen levels to the level of menopause. And then when you stop and your cycles come back, the estrogen comes back too. But I wish more postpartum women would even use vaginal estrogen.
This is a good tip for people to know.
We're paying all of this money for our face.
Right.
But got to take care of everywhere. What do you think? What do you think of like estrogen on the face?
So, there's a lot of things that can induce collagen, and estrogen happens to be one of them. But you have to remember, our skin is good at absorbing things. So if you're slathering estrogen on your face, you're doing a little bit of estrogen replacement therapy. Now, if it's low dose, if it's the cream that you normally would use in the vagina, low dose vaginal estrogen, estradiol is more potent than estriol. So I've seen a lot of like creams out there with estriol. It's a weaker estrogen. But you have to be careful. I mean, how much you're putting on your face? Because when we dose low dose vaginal estrogen, those women are taking that twice per week. If you're putting, excessive amounts of vaginal estradiol cream on your face every single night, you're getting some level probably of systemic estrogen. So you want to know what you're using. But it does. I mean, it can increase collagen. There's lots of other things that can help with anti-aging too. So do I think it could be, part of a regimen? It could be. We don't have a lot of studies. Like we don't have like big, giant, robust studies. So I think people have to, take that with a grain of salt. There is one case report of a gal from Europe who was slathering estrogen on her face for like many years. She ended up getting endometrial cancer because she was putting like way too much estradiol cream on her face. And estrogen is proliferative and progesterone is anti-proliferative. So if you're giving too much estrogen postmenopausally, you have to be taking progesterone to balance that out. So you just got to be careful with how much you're using and what you're using, and know what you're putting on your body. Because
it is the same. Like if you had a tube, you could use the same to put on your face as in the vagina.
Okay, so it's the same.
Yeah.
Okay. What do you think about the patches?
I'm a huge fan of estrogen patches. It's convenient because it's twice per week. I like the twice weekly and not the weekly, because if you've never seen a weekly patch, like they are big and ugly. So the twice weekly patches are great. Outside of a patient like with an adhesive allergy, most patients, love it. And then if you have a uterus, you have to take progesterone with it. But I put most of my patients on progesterone anyway if they don't have even if they don't have a uterus, because there's benefits of progesterone. And like I said, in the body, we have estrogen and progesterone receptors in almost all of our tissues. One is proliferative, one's anti-proliferative. So we really should be taking them together.
You have this powerful quote of those who don't make time for wellness will have to make time for illness. What does that mean in practical terms? Is we're getting this information out. And as you said, there might be 1 in 27 men, 1 female and 27 men in the weights room, where now it might be 10 to 20, 27. What impact does that have for women over 40 if they're still, I think the message is being received. I keep saying this in my podcast, like it's definitely on social media. If you're following women's health specialists, everyone's kind of talking about some form of strength training. There are different recommendations, some form of good nutrition, as you said, different recommendations. But that quote right there really says it all.
Yeah. I mean, life is going to catch all of us, at some point. And, I kind of said this early in the podcast. I know people with massive financial success, relationship success, maybe they're physically, really healthy and successful, but at some point life catches up with us. And if we aren't taking care of ourselves, usually when it gets to that point, most people would give up their entire bank account to have their health back. You get some crazy cancer diagnosis and you're like, God, I wish I would have over the last 20 years, like known this was coming. Well, I'm telling you right now, like it's coming.
Yeah.
Something is coming for you. You might be 100, you might be 40. But something is kind of like we are not immortal. And so, we're going to do the best we can. We're going to try to take care of ourselves the best we can. Because if you get a bad diagnosis, like cancers in particular are curable at stage 1 and 2. And you can do all the testing you want. You can get 1,000 biomarkers and do a full body MRI and you can put on the wearable devices. But like, what do you do with that information? The way that you actually, do something about that is more important than doing all the testing. And I know I have some real crunchy patients that are like, I don't want any of the tests. I'm just going to like do the healthy stuff, which is fine too. Like don't order a test if you don't want to know the answer. But I mean, at some point in our life, like something's going to happen to us, something's going to happen to our family, and we want to be hard to kill. So I'm telling you right now, if I get diagnosed with cancer tomorrow, I've got a lot of muscle mass. I could probably be in bed for several weeks and still make a good recovery. I can, you just want to be as resilient as you can to fight through whatever challenge life is going to throw at you. And, when it comes to our health, like we have to take an active, proactive, approach to it. You got to be in the driver's seat.
Yes, exactly.
And the thing is like nobody can do it for you. I mean, I can sit in my clinic all day and tell patients like, read my book, like do all of these things. But like at the end of the day, the answer to our healthcare system problems is for people to take self-accountability for their health. Like you're in charge of what you eat. You're in charge of how many days you're going to set the alarm and go train. And for me, like you can't hate exercise. Like there's something that you like to do, and for me, it's not like I have to go do this. It's like, I'm going to go to the gym at 5 a.m. and I'm going to celebrate like how awesome my body is at 40 years old and look what I can do, You got to celebrate what you can do. Cause I think women are really good at beating ourselves up about what we don't like about our bodies. But there are things that are going well in your life. And I am perpetually a glass half full kind of person. Like if I got a hip that's bothering me, like you're not going to hear about it because my other hip is good and I can do arms if I can't do legs. And if I can't run, I'm going to walk. And if I can't walk, I'm going to crawl. Yeah. Like, I mean, that's just like how you have to look at it,
Well, you've been a huge inspiration. I have loved following your journey, and I really like your stance on socials. And thank you for spending your time with us.
No.
So I think I asked you, but maybe I didn't listen to the answer. When did your book come out? When did you write that?
Yeah, I should know. It was August of 21, 22. It's been out for a couple years now.
Oh, awesome.
And people can find it on Amazon, wherever books are sold. It's on Audible. I didn't realize how many people like to listen to Audible and books on
Me
on
too.
their smart devices. Yeah, I haven't. That's so cool, right? You can just like drive in your car and listen to it. So, it's a very easy read. It's written at a level that like my kids could understand. It's not like super sciencey, but it just has real world actionable things that you can start to implement in your life.
I love it. Hard to kill. And you are Dr. Fit and Fabulous on Instagram.
I still giggle about the name.
No, I love it.
It's easy to remember.
Because anytime I would try to type like Jaime Seeman, I'm like, oh, I got to put in Dr. Fit and Fabulous to pop right up. So awesome. Well, thank you for sharing your time with us and your expertise and just your take on life for women at this age group.
Well, I've been inspired by a lot of people in my life. I mean, there are still stories, like from my childhood when I think back to like certain things that really kind of shifted me and my mindset. And I hope I can be that beacon of light for people. And really, honestly, the reason I do it is I have 3 daughters, and I hope that I can kind of like have lived the lessons for them. They're kids, and I'm going to let them mess up and make their own mistakes. But I have 3 girls. And so I look at them and there's things that I wish I knew at their age, that I didn't, and that's okay. And I'm just trying to be the best example for my girls and all their friends and other moms out there. I mean, it's hard. Our lives are really hard. We have a lot of expectations that society puts on us, and you can do whatever you want in life. You just got to work hard.
There you go. That's it. Well, we appreciate your time, and you can find Dr. Seeman on Instagram at Dr. Fit and Fabulous. Thanks for listening, everyone.
If you enjoyed this episode, please consider giving us a 5-star rating and sharing the Body Pod with your friends.